In this lecture, we will discuss the TP segment, specifically what it represents and how it should normally appear on the EKG. The TP segment represents the time from the end of the T wave to the start of the next P wave. So if you look here, we can see our TP segment, okay? This is a P wave, this is our QRS complex, this is a T wave, here's the next cycle of the next P wave, and we're saying that the TP segment comes from the end of the T wave, this point here, until the start of the next P wave. Okay, so this point here is our TP segment. Now the TP segment is normally isoelectric and located at baseline, as we see here. It occurs during ventricular diastole, that is when the ventricles are relaxing and filling. So you look here, here's ventricular diastole, this is systole, okay, and the TP segment is right in that period of diastole. Now the TP segment was formerly considered the reference line or baseline used for looking for ST segment deviation, whether elevation or depression. Now the new guidelines suggest that the PR or PQ segment should be used as the reference line. Okay, so if you look here, our PR segment is from this point here until the start of our QRS complex. Okay, so that's our PR segment, sometimes referred to as the PQ segment if there's a Q wave that starts there. Okay, so the PR segment used as the baseline that we're looking for any deviation of the ST segment, which is this portion here. Okay, so the ST segment is right here, and if there's any elevation or depression, now we use the PR segment. So before, we used to consider the TP segment as the baseline there, okay? Now, some reasons for using the PR segment as the baseline include that the TP segment may be difficult to visualize during fast heart rates in which the intervals shorten. In addition, it is believed that a new baseline for the heart is set after atrial repolarization, so using the TP segment wouldn't make much sense. In cases in which the atrial repolarization wave, or TA wave, is present and deviating the PR segment, the TP segment may be considered. Okay, remember, if we have any atrial repolarization, okay, that wave is going in the opposite direction of our P wave. Right? This represents atrial depolarization. Normally we don't see the repolarization wave, but if it does, it go in the opposite direction. All right, where we call our TA wave or atrial repolarization wave. So if that deviates the PR segment, you may consider the TP segment. But what we're saying is after the atria repolarize, there may be a new set point for the heart that may now affect how the ventricles depolarize and repolarize. And that's why we use this point here instead of the TP segment. Anyways, for our purposes, we use the PR segment as the baseline and realize that faster heart rates shorten the TP segment and may make it difficult to visualize it. So if you look here, we see our P wave. Okay, we'll use a different color. This is a P wave, QRS complex, and a T wave. Okay, and the same thing, P wave, QRS, T wave. Okay, and up here we have a P wave, QRS, T wave, and you see it going on. And the only difference between 1 here and 2 is that this 1, 2, it has a faster heart rate. So if we look at the TP segment, so this is our next P wave, would be from here to here. Notice that it is longer in 1 than the one with the faster heart rate. Okay, notice the TP segment is longer here with a slower heart rate compared to that. Okay, so as our intervals shorten, so does our TP segment. So that's just something to be aware of. All right, let's briefly review what we discussed before we end. The TP segment represents the time at the end of our T wave to the P wave onset. Normally, we said it's isoelectric, located at the baseline. The cardiac event that we should know about is that it occurs during ventricular diastole that we saw here. It's formerly considered the reference line for ST segment deviation, whether elevation or depression. Now we use that PR segment. However, the TP segment may be useful if there's any deviation in the PR segment because of that repolarization wave. Now, in terms of heart rate, as the heart rate goes up, this shortens the TP segment, okay? And if you get these rapid rates, okay, this TP segment may actually go away where you have the T and the P waves fusing together, okay? And that's why we don't use this TP segment as the baseline. Well, that's the end of this lecture. We discussed the TP segment, specifically what it represents and how it should normally appear on the EKG. I hope you learned something.